and do our introduction, and then hopefully everybody that's joining us will be on. Welcome to CVSA's June virtual presentation, Acupuncture as an Effective Tool to Manage CVS Symptoms. Before I introduce our speaker, I want to introduce myself. My name is Debbie Conklin. If you have contacted the office in the last 5 years, you have talked to me as I've been the program director since June of 2016. My involvement with CVSA started with organizing the Run for the Bucket in Wisconsin shortly after my son's CVS diagnosis in 2005. In 2007, I joined the CVSA Board of Directors, and in 2016, I became the program director. For the duration of the presentation, you will all be muted. Please do not unmute yourself, as background noise is distracting to both the speaker and those attending. Please do not use your own recording device during this presentation. We are recording it, and it will be posted on our YouTube channel for later viewing. If you're having trouble with your audio, you may consider using your phone to call in instead of using your computer speaker. We have about 75 people registered for this meeting. That means that we may not have enough time to get to everyone's questions, but we will do our best during the question and answer session. You can submit your questions in the chat box at any time during the presentation, and I'll ask them in the time we have available. You can post, sorry, I already said that. Please keep your questions on the topic of acupuncture. And now for the main attraction. We would like to welcome Miss Megan Bielinski as this month's presenter. Megan Bielinski has been practicing acupuncture in Milwaukee since 2015 after pursuing her master's degree in Traditional Oriental Medicine at Pacific College of Health and Science in Chicago. She is currently the vice president of the Wisconsin Society of Acupuncturists and an active advocate for expanding acupuncture care in Wisconsin and at the national level. She has given talks and demonstrations on acupuncture at the Wisconsin Capitol, veterans groups, local health departments, and corporations in order to expose the public to the wide-ranging benefits of acupuncture. Ms. Bielinski first experienced the benefits of acupuncture as a patient. After experiencing severe migraines for years and being unsatisfied with the relief provided by Western medicine, she found her condition dramatically improved with acupuncture. Megan is currently practicing at the Milwaukee Community Acupuncture, a community-style sliding scale acupuncture clinic in the Bayview neighborhood of Milwaukee. Community acupuncture allows patients an affordable option to receive regular acupuncture in a recliner next to their neighbors for those who don't have acupuncture coverage included with their insurance. Community acupuncture is gaining popularity through the US and Canada. And I know Megan plans to talk a little bit more about the community acupuncture as well. Thank you so much for everyone on today, and thank you, Megan, for joining us.
Thank you, Debbie. I'm excited to be here. Hi, everybody. Good afternoon. I guess I will share my screen. You can see that? Great. All right. So as we talked about before, I'm just going to kind of give you an overview of acupuncture, what it's effective for, what's it used for, how does it work, what's the evidence supporting acupuncture, and is it painful, which is a really great question, especially for people who are younger, curious, you know, and all those things like that. So I am licensed in the state of Wisconsin, and I'm also licensed nationally through the NCCAOM, which is fairly common. If you're in a different area, you can search for acupuncturist through the NCCAOM's website so that you always know that someone is licensed, which is very important. I'm the vice president of the Wisconsin Society of Acupuncturists, and I've been practicing at Milwaukee Community Acupuncture since 2015. We are open 7 days a week, which is pretty rare, but it really allows our patients the opportunity to come in whenever they can to get the treatment that they need, whether that's last minute, if they're not feeling well one day, or if it's something that they're regularly coming in and their work schedule isn't allowing them to come in from the 9 to 5 hours that a lot of doctors keep. So there's many ways to find an acupuncturist. I would ask for a doctor referral if you have a doctor that you trust and like, friends and family, or acupuncture association websites. So to become an acupuncturist, I thought this was just something that I would throw out there because I think a lot of people aren't really familiar with acupuncture in general. Acupuncture is a 4-year master's program, and there's over 1,000 hours of supervised clinical training, and you have to complete 4 medical boards in order to get your license. So it's a very detailed, thorough process. And, you know, the whole benefit is that you're getting someone who knows the medicine. So Eastern medicine and Western medicine, which you'll hear me say a lot throughout this, are very different systems of looking at the body. But the overlap, it's kind of like a Venn diagram. So there's a lot of overlap. These are some pictures from our clinic pre-pandemic. No one's wearing a mask. We have chairs in the rooms and it's very quiet. We have a lot of noise machines. But, you know, there's a lot of benefit that has been researched about sitting next to someone else who's getting acupuncture, from just kind of a spiritual, emotional health. And, you know, if you're feeling like you're alone in your health quest or just wellness journey, you don't really have to feel alone, but also metaphysically and energetically, your energy is affecting someone else next to you and helping them feel better faster. So acupuncture is a centuries-old system of healthcare with origins in China and Greater Asia. We use thin, solid, single-use needles inserted into the acupuncture points along the meridians. So this channel here that you see in the picture is the lung channel, and that goes up and straight around to the nose to kind of affect congestion, allergies, but also affect the lungs and kind of help you know, clear out some of the phlegm that we accumulate over time just through diet and lifestyle. So there's over 365 points identified on the body. There's way more than that. But research shows that some points are located where the nervous system is most superficial. So that's really the most basic way to explain how acupuncture works, is that this micro trauma is affecting the nervous system and the way that the brain is perceiving the illness or the trauma that you're having in that particular area. Needles are inserted shallowly on the surface of the skin. And sometimes we like to call them pins and not needles, because needles are hollow and pins are not, and that sounds a lot nicer. The acupuncture needles are thinner than a cat whisker. The needles that we use are 0.16 millimeter. So that's the thinnest and most bendable needle that you can get. And also Chinese medicine, which includes acupuncture and Chinese herbs, is something that people practice in addition to acupuncture. So when I talk about acupuncture, I'm also talking about Chinese herbs, but that can come, you know, during a course of treatment or later during the course of treatment. Acupuncture is used to treat the whole body. Even from the recliner, we're treating people for back issues, stress, anxiety, mental, emotional health, which we all have, muscle pain, joint pain, headaches, migraines, abdominal migraines, sinus congestion, vomiting, diarrhea, nausea, GERD, menstrual cycle irregularities, and the list goes on. Acupuncture is a gentle, drug-free way to help the body function better and heal itself naturally over time. So this picture, I just love this picture. Acupuncture was introduced to America during Nixon's 1972 trip to China, which was really the first time that Westerners were kind of exposed to acupuncture, because James Reston, a reporter from the New York Times, had an emergency appendectomy, and they used acupuncture during his surgery to deal with the pain that he was having. And also, you know, after post-surgical, the pain that he was having from the surgery, you know, for digestive issues and things like that. So his story was on the front page of the New York Times. which was a really big deal at the time. There was no state in America that had licensed acupuncture. The first state to license acupuncture was California, I believe in 72 or possibly 73. And then it kind of trickled in from the West Coast and the East Coast. Acupuncture in Wisconsin was licensed in 1989, I believe. And before that, people were getting arrested for doing acupuncture, but acupuncture in America, 73, Nevada, in 1989. Yeah, this is just a good picture of Nixon eating some Chinese food. So acupuncture in America, it's currently estimated that 3 million people have tried acupuncture. So that's only 1% of Americans. If we think of America being 330 million people, that's a really low number. So there are some reasons for this. There's not as many licensed acupuncturists. As of 2018, there are only 37,000 acupuncturists compared to almost 1 million physicians. So being able to find someone in your area, being able to, so if you live in a more remote area, it is harder to find. The 10 states with the largest number of acupuncturists are, on the coast. So I will say the number one is probably people being afraid of needles, which I understand. I myself was afraid to try acupuncture, which is funny to say now because I'm an acupuncturist. But I really went into it with an open mind, and the benefit that I saw outweighed any kind of discomfort or stress or anxiety that I experienced during my first few treatments. Some people think it's a placebo, but there's a lot of research on placebo that says, hey, maybe it's not such a bad thing after all. If you feel better, is that really placebo? And sometimes, and generally, this is a big problem, inaccessible because of cost, which, a lot of acupuncturists don't charge insurance. And so then it's an out-of-pocket cost, which can be anywhere from $80 to $150 per treatment. So what is community acupuncture? Patients are treated in a large communal room in recliners. Excuse me. We do a lot of points below the elbow, below the knee, hands, feet. And so there's no disrobing. It's totally safe. We can do as much of the arm or leg as you want. Sometimes people come in with skinny jeans, and that doesn't really give you a whole lot of options, but there's always options because there's so many different acupuncture points. Our sliding scale is 20 to 50, and we have a $10 new patient fee. So in order to keep our costs low, appointments are scheduled every 10 minutes, actually every 15 to 10 minutes. We're kind of working that out through the pandemic with all the extra cleaning. But one thing I say to my patients all the time, acupuncture is like going to the gym. It works best when you use it often. I don't go to the gym twice and expect to lose 5 pounds. If I did, that would be great, but gyms are regular places you have to go often. You have to commit to it. It took you a long time to gain that 20 pounds that you want to lose. And on the reverse, it takes a really long time to kind of get you back to where you want to be. So this is our treatment room now. We have a couple of different rooms. We're actually getting new chairs soon, which is very exciting. It's, kind of like Christmas for us. So you can also train to become a community acupuncturist. This is a co-op that we belong to. It's called POCA. And so you can do a 2-year master's program to be able to spread community acupuncture across the country, which I would say currently there's probably 100 to 150 community acupuncture clinics part of our co-op. So the case for community acupuncture, I would highly recommend reading this book. I think I got it at the library. Energy Medicine by Jill Blakeway. Basically explains and kind of walks through some research that signifies a profound concept that one person's heart waves issuing from their heart's electromagnetic field can detect and affect another person's brain waves and vice versa. I believe this may be what may be happening when I perform treatments in my clinic. So, being in a room with other people is comforting. People go to religious services, people have meetings together. I think we've all kind of through the pandemic realized that we like being around other people. And it kind of helps amplify the treatments in a way that I have not seen in private treatment rooms where you're alone on a massage table. How does acupuncture work? There are thousands of studies as to the mechanism of acupuncture, but it does not seem as though people have come to a consensus. So these are the different ways that it works. It upregulates or downregulates the nervous system and can decrease pain signals to the brain. Acupuncture stimulates the body to increase circulation and blood flow to the muscles, thus decreasing pain. And studies show that acupuncture helps the body to release endorphins, serotonin, dopamine, and oxytocin, the happy hormones. Is acupuncture safe for children? Yes, most definitely. Doing my research on cyclic vomiting syndrome, I saw that there are a lot of children who, and I know Debbie said her son was diagnosed at a young age. But there's also a lot of adults. So there's a technique, and these little tools on the bottom are called Shonation. It's a Japanese acupuncture technique where you use the tools on the acupuncture points for little children. So this child in the picture is probably a year old or so. And we let the kids play with the tools, but a children's acupuncture experience is very different than adults. The theory is that children have a lot more yang energy. What is yang energy? Yang energy is they're up all night. They can go. They never feel tired. They wake you up early in the morning. They just have a lot more energy than we do. And as we age, this declines slowly over time. So using these tools is as effective as using the needles for older children and adults. So we have done acupuncture in the community clinic on kids as young as 3 and 4. We really always say that if your kid can sit still for like 15, 20 minutes, then they can do acupuncture. And we use very few needles and we walk them through it. But I would say the biggest piece of advice is that your child has to be willing to do this. You can't force your child to try this. You need to have the conversation, and perhaps you come in and they come with you and they see how it works and they kind of get a feel for what it looks like. But it's hard to force a kid to do something they don't want to do, as you know. But acupuncture is very, very effective for children, and they need fewer treatments, and their treatments last longer, I would say. But another good resource, as I'll talk about later, is Chinese herbs, diet modification, and essential oils. That's me with a mask on. How does acupuncture work? A couple other theories. They've done Doppler ultrasounds to see how it increases blood flow and circulation. There's the endorphin theory, the gate control theory of pain, which is that the spinal cord can open and close based on a stimulus. The idea is that the needles offer stimulation or a micro trauma to close the gate, shutting down the pain to the body and triggering the change in the brain physiology. Or there's the injury theory: wounds inflicted by acupuncture needle ramp up the body's immune system and thus jumpstart the healing process. This is another really great book, The Spark in the Machine. So he, Dan Keown, is a surgeon and acupuncturist in Britain, and he makes the argument that the human embryo develops nodes that function as organizing centers, dictating how our bodies take shape, as well as creating an electrical network that corresponds with the acupuncture points and channels of Chinese medicine. So coming from, I believe he's a neurosurgeon, that idea of kind of what are these channels really doing, and is this real, and but kind of connecting the Western theory of the nervous system, it really makes a lot of sense. There's lots of research. If you've never heard of a website called PubMed, it is the largest free online database of searchable health and life science research maintained by the National Library of Medicine and the NIH. When you search acupuncture in general, there's 30,000 results, and acupuncture and nausea and vomiting is 668 results. So one that I just picked up was across multiple prevention and treatment of nausea across multiple patient populations. And it's a review, which means that they take a lot of different studies and they kind of comb through them and see, is there more studies that say it works? Is there less studies that say it doesn't work? So their efficacy has been proven, acupuncture and acupressure, for nausea and vomiting related to pregnancy in patients receiving chemotherapy and in post-operative pediatric and female patients. So they're saying all of these patient populations did well and saw good results using acupuncture for nausea and vomiting, which is my experience. I believe that, you're never going to feel worse after coming in for acupuncture. You're always going to feel better. You might not feel as good as you want, but there's a lot of different factors that go into how we metabolize drugs or different therapies, basically, so that if we are able to try something different, I think for a lot of people, having options is a good way to feel like you're in control of your health. At least it was for me. I really wanted something that, I didn't have to be beholden to my migraine medication. I wouldn't have a panic attack if I left it at home. So acupuncture was that for me. I felt like I could control it and I could see the results that I wanted to have and live the life that I wanted to live. This is a really interesting study. So this is basically showing the acupuncture points in this colored diagram for the wrist. And so those are different channels. So where it says PC7 and PC6 is below that. PC6 is called pericardium 6. And that point, if you use 3 of your fingers, so there's the measurement in Chinese medicine is kind of based on your body size. So it's too soon, C-U-N. If you use 3 fingers together and you place it on the wrist crease where your forefinger ends, kind of right in between those 2 tendons is where PC6 is. People use those nausea bands. That's where you're supposed to put it. So PC6 is the nausea and vomiting point. So when you combine that with a couple other points, it really does well to kind of reduce the nausea. So just a gentle, clockwise pressure on that point can really help reduce some nausea and kind of help you feel better just in general. So this is saying that the acupuncture points, the level of nitric oxide at the skin surface is higher where the acupuncture points are located, which is fascinating to me. So what does nitric oxide do? It's used for a lot of different things. It's naturally produced by your body, but basically it's saying that acupuncture points are important because they are a highly localized area where vasodilation from nitric oxide can occur. Vasodilation assists inflammation by increasing blood flow to the damaged cells and body tissues, This enables more effective delivery of the immune cells necessary for defense and repair. So for me, this is the number one tops, to show that, you know, your body has these markers and they correlate with acupuncture points is fascinating. There's also Chinese herbal medicine. So this is a formula that is typically used for nausea and vomiting. It's called Bajintang. And the little herbs and pieces on the side there are kind of what is inside of it. So ginseng, licorice, cinnamon bark, ginger, jujube, Chinese date. You know, a lot of herbalists will do raw herbs, which just means you take these twigs and berries home and you boil them up in water, and then you get a tea and then you drink that. Some people don't like that. Some people prefer that. We sell ours as tinctured supplement pills. So it's much easier to take. And, you know, they also have for children, there's a lot of tinctures that you can just put under the tongue and kind of ingest that way. I would caution to never self-prescribe. You always want to consult a licensed herbalist before starting any therapy. You can buy some of these formulas online, but there's a reason that we go to school for 4 years to learn herbs and acupuncture, because it is a very complicated medicine. It's safe. I'm not saying that it's not safe, but it's also something that has a lot of nuance. And you know, a lot of patients will talk to their doctor about Chinese herbs, and they know nothing about Chinese herbs. They've never studied Chinese herbs. My only concern when talking to patients is if they're on some kind of blood thinner or heart medication. That would be the only time that I usually say, I don't think herbs would be a good mix for you based on what you're taking already. But herbs are very safe. They're food. You know, they're things that we ingest on a regular basis, but these certain types of foods do different things in the body. So kind of like when you bite into a lemon, which you would probably never do, but it puckers up your mouth and it produces a lot of fluid. And that's kind of what the herb is meant to do, have an effect on the body internally. Some more pictures. This one's an up close. So see, you can really barely even see the tail of the needle is what's sticking out of the end, but the needles are really, really fine. And I would say somewhere between like 15 to 20 needles per person is, you know, between your whole body, heads and arms. That's about all that we would use. Is acupuncture painful? Good question. I would say the majority of people claim that acupuncture is not painful. I always tell people you'll just feel a little pinch or a prick. That sensation should dissipate within a few seconds if it does not let me know. Sometimes, you know, everybody's anatomy is a little different. Sometimes we might hit like a nerve or a hair follicle, and that can be uncomfortable, but that sensation goes away really quick. But, you know, as you're laying there with the needles and you're not feeling anything at all, you're really just feeling better. You're feeling a deep relaxation and a deep, sometimes people fall asleep. Sometimes people go to another plane. I've heard people say, you know, there is a like spiritual connection that you have with yourself while you're laying in the chair that allows you to process a lot of things, whether that be, you know, physical stress from, you know, dealing with this illness all the time, or, you know, just kind of like a really great nap in the afternoon. And who doesn't love that? But if you're not a fan of needles, you can always try a meditative breathing. So I always recommend meditation for people with lots of different issues. So we recommend you turn off and silence any technology. You want to find a quiet, sunny space to be alone for 10 to 20 minutes. The most important thing when you're starting meditation is to not get down on yourself for not being good at it. There is no such thing as being good at it. Chinese monks have been doing this for years and years and years, and they don't feel like they're good at it either. Just mainly focusing on trying to clear all of the thoughts out of your mind and focus on only your breathing. Breathing into your belly is most important instead of raising your shoulders. So doing, there's this 4-7-8 breathing technique that is really simple. You can look it up online. What it's doing is something called switch breathing, which when you're breathing in your nose, but then you're breathing out your mouth. So that changes the way that your nervous system experiences your breath and the way that your brain is experiencing the sensation, and trying to switch from fight or flight. I'm running away from a bear. I'm in stress. My body is taking a toll, into rest and digest. I'm going to sleep. I'm really relaxed. So you want to inhale for a count of 4 through your nose, hold the breath for a count of 7, and then exhale, making that whooshing sound for a count of 8. If you're not perfect on your numbers, that's totally okay. You're doing a lot for yourself just by, doing the best that you can. And yeah, this is breathing exercise is a natural tranquilizer for the nervous system. But unlike tranquilizing drugs, this is subtle, and when you first try it, you gain power with repetition and practice. Try to do it at least twice a day. You can't do it too frequently. Yeah, and it's really just about practice. You can listen to music, you can sit quietly, try and find something, and then you'll start to realize that trying to find that quiet space and that time for yourself really helps you check in with yourself and see what's going on and kind of slow down a little bit and figure out how you're feeling without all the other clutter around your mind. Essential oils are a really great tool additionally for cyclic vomiting syndrome, for people with migraines as well. This is a study that talked about post-operative vomiting. So it used peppermint, ginger, or a combination of both. Ginger, excellent for nausea and vomiting, peppermint as well. The conclusion was that aromatherapy demonstrated a statistical significance reduction in the need for antiemetics to treat postoperative nausea and vomiting. My recommendation for people as well is to, I think in this study, they had people use an inhaler, so they were just breathing it in. I like to use it on the skin. Essential oils, if you're buying decent essential oils from a reputable source, so whether that's like a homeopathic apothecary in your neighborhood or online, doTERRA, what's the other one? There's lots of different brands that are organic and cold pressed and as pure as you can get. I like to use it on the skin. If you don't have sensitive skin and you're not allergic to any of these herbs, is to just put some on your finger, rub it so that you're getting a little bit off of your finger. So rub it between your finger and your thumb, and then rub it on the belly and kind of down the sternum. So in Chinese medicine, the thought of nausea is that it's not being rooted, the qi is not being rooted in the stomach the way that it should be. So when you can strengthen the stomach, the visual image of stomach qi is that there's this big pot and it has a good fire underneath it. And so it's boiling up and reducing and churning all the different foods that you eat so that you can absorb the nutrients that you need and excrete what you don't need. So we want to strengthen that belly fire to keep everything down. A good way if you're feeling nauseous or vomiting is to go counterclockwise. I was trying to think of a way to make this intuitive. So if there's too much coming up, you want to keep it in. And that way you want to go counterclockwise. You don't want to go forward in time. You want to go back in time. And now conversely, if you're having constipation, you would go clockwise in order to get things moving. So just a gentle, starting at the belly button and then kind of going down maybe an inch or two, and then going up through the stomach, kind of to the bottom of the sternum, and kind of doing that gentle massage is very helpful. All right, questions. I believe we're at the end. I do have a few more slides. I just wanted, normally if I would do this in person, we would have, a volunteer for this ear needling, which is called the 5-needle protocol, or AcuDetox NADA. It's good for stress, pain, and relaxation. In different states, there's different regulations, but in the state of Wisconsin, anyone can become certified as an auricular acutechnician, which just basically means that you're able to use these 5 needles in the ear under physician delegation. So what we're trying to do is we're trying to expand acupuncture to populations that might not normally have access to it. So, a lot of self-help groups, or drug therapy, or even people who want to use it at like a support group for CVS. So I will just leave that up there. Debbie, thank you very much.
Perfect. Thank you so much, Megan. I have had acupuncture and I read about it, but I still learned some things today. I don't see any questions in the chat box yet. However, I actually wrote a number of them myself. So if you have questions, please put them in there and I will try to get them all answered. But I'll go ahead and start with the ones I wrote down. Is there any benefit to receiving just individual acupuncture in your private treatment room that you don't get in community acupuncture?
Yes, that is a great question. There is. I would say for some people, it's kind of personal preference, I think. But there are benefits as far as needle location. So you can use more back points, and the back points, go down a line from basically the occiput, the base of the skull, all the way down the back. And those are your most constitutional points that kind of build up your constitution. Is that what's a better word for that besides constitution? Your strength and your body's own ability to kind of deal with everything surrounding it. So sometimes, in Chinese medicine, we talk about being born constitutionally deficient. Some children just don't have as much, they get colds really easily and they're always sick, or they're, breaking bones more easily than other children. That would be a really good example for that. And also, private practitioners are able to more use the auxiliary techniques as far as like moxa, which is MOXA, which is a burning herb therapy. Sometimes you can do that on the back. Sometimes you can do that on the stomach. I think it's personal preference. I always like to think of the cost issue as something, if you can't afford to do the amount of treatments that they recommend, which is sometimes like 8 to 12, when you first start treatment, then if you can afford it in a sliding scale place and you're going to continue treatment, then that to me is the most important thing. But if your insurance covers it, that is great. And then I would recommend, trying to find someone that you like, someone that you, a practitioner that you trust, and a practitioner that you get along with.
Right. That's a great answer. I have only experienced the community acupuncture, and I mean, I love it, but I just was kind of curious as to the difference. Can acupuncture be used as a preventative option for conditions like migraine or like CVS?
Yes, definitely. Migraines and CVS are very random as far as like for some people, there's no real triggers, right? It's not food, it's not environment. Sometimes you can figure out your triggers, but a lot of times it seems like there's not a whole lot of rhyme or reason why this is happening. So that constitutional strengthening is kind of where we're starting, to kind of increase the circulation so that the stagnant qi, which is something that we talk a lot about in Chinese medicine, is moving, right? So sometimes you can move that with exercise or yoga, but when you're not feeling good, that is not very easy to do. But kind of getting to a place where you can control your migraines and you can control the vomiting, or you have, you can start to notice patterns in them, I think is really helpful for people. But yes, what we recommend is that people come in for a series of treatments, and then we get them to a place where things are manageable. And not to say that we release them from treatment, because sometimes that's just not possible as far as, their symptoms would return. So doing kind of a maintenance, kind of like taking your car to get an oil change. It's really important. If you don't do that, the car's not going to work anymore. I mean, over time, it will start to break down. But yes, acupuncture is highly effective for treating migraines, headaches, vomiting, nausea, CVS. It's a really gentle way to kind of help your body just experience less of that trauma just on a regular basis. The more that you're experiencing that, the more your body it heightens the defense every time too. So a big part of acupuncture is to kind of, be like, hey brain, things aren't as awful as you think they are. Let's bring this down a little bit and then see where we're at, and, things like that.
And how many treatment, let's say I've never had acupuncture before.
Yeah.
How many treatments are typically needed to see a benefit?
Depends. Sometimes for myself, the first time that I had acupuncture for migraines, I didn't have a migraine for probably 2 to 3 weeks after my first treatment. I wasn't able to go back. My work schedule was crazy, but I was so shocked at how fast it worked. And that's not to say that it didn't come back. Some people notice benefit within 1 to 2 treatments, but it doesn't last. Some people, it takes 4 to 5 treatments to see anything. Kind of like how I was saying before, how we metabolize different medications, and we all have different ways that our bodies function. But I would say if you're not seeing any change or any significant, I don't know that it has to be significant. I always tell people if it's change, it's good. That means that we're working it towards the right direction. It might not be as much change as you want it to be, but the benefit is, it's more lasting than saying taking a medication, it wears off in 12 hours, that kind of thing.
Makes sense. Thank you.
Yeah.
Are there any contraindications to having acupuncture?
Yeah, that is a good question. I would say, I'm trying not to be, too, no, not really. The only time we wouldn't do acupuncture, there are points that are contraindicated during pregnancy, because they are too moving and you could cause a miscarriage. But sometimes there's contraindication if you're doing private treatment and someone wants to use E-stim, which is just like an electrical stimulator, kind of like those little pads that you would use sometimes for someone who has like a pacemaker. But if someone has blood sugar issues, possibly that might be a contraindication if they faint easily. But I've never had that happen to me. It's a very gentle therapy. It's very, it kind of works with you where you're at. So no, I would say there's not a whole lot of contraindication.
Great. What does it mean when your arm falls asleep or gets kind of achy during acupuncture?
Yeah. Well, it probably means that the chair isn't very comfortable. um, or achy. Achy means sometimes I will have people say, oh, I was laying here and then my arm started hurting, but then my opposite leg was hurting and then it kind of all went away. And there are these cycles of chi, right? So your body cycles through the energy in your body in a 24-hour cycle, but then also in shorter cycles. We're moving that energy around. It's kind of like a super highway, right? So we want to say, hey, there's a dam at this river. I want to open this up. So that might produce some pain in another area that had been kind of dry. If you think of a river that's not getting enough flow to the end of the river, that's really the best way to explain it. But it's normal, totally normal, to feel that way, to have that experience. Sometimes it's just blood flow too. If you're laying there for 40 minutes or whatever and you're not moving around, it's pretty rare that we would do that unless we were sleeping, and sometimes our hands go numb when we're sleeping too. So
yeah, great. Yeah, I was just asking because I know I have experienced that a few times when I've had acupuncture. Do the community style acupuncture clinics, and I know some of them are different than others, but do they typically offer that, and I'm not sure if I'm saying it right, the Shonation for kids?
Yeah.
Is that typically offered at a community place or not usually?
I don't know. I know that we try and offer it because we want children to be able to use our treatments, because Amy and Olive, the owners of the clinic, have little kids and use it on their kids all the time. I would say, I would call beforehand. It is more like labor intensive, and kind of the benefit of the lower cost is that you don't have to spend as much time with one person. So it can be more difficult. But that's not to say that they couldn't make, accommodations. A lot of private acupuncturists would definitely do Shonation, and they have more time, and you would need less treatments if you're, working with a child, because of constitutionally, they're very robust. They could do very well with few treatments. Adults, it takes a little more time to unravel that ball of yarn.
Definitely. Great. Let's see. You may have kind of answered this, but how long is a typical an individual acupuncture treatment?
Yeah. So typically we let people rest in the chairs for like 35 to 45 minutes. So when you would come in, private acupuncture, your first appointment can be upwards of an hour and a half. We're asking a lot of questions because we want to know, what is the root of why you're having this issue? Because there is a lot of different, it's kind of like a tree, right? And then you try and find the root and you try and dig down deep, but you have to know which branch you're starting on. So we'll ask you, how's your sleep? How are your bowels? How, what's a typical episode look like? Can you explain in detail? Can you give us as much information as possible, to kind of get at a fairly good diagnosis, to be able to kind of go forward with, using the best treatment combination for herbs, acupuncture, moxa, things like that.
Awesome. I had a question and it just left my brain. Oh, I know. Why, and I know you're not doing this because of the pandemic, but why do they look at your tongue?
Good question. So in acupuncture, what we do is we'll feel your pulse, and it's a 3-fingered pulse on both sides. So we are feeling for different organ systems, and there's a high level and a low level. And so that's just to say whether like the chi level and the blood level, is this something that's a deeper issue? And so similarly, the tongue gives us a lot of information. So we look at the color of the tongue. Is it pale? Is it bright red? Is there like a lot of scalloping? We look at the shape. We look at like, are there big cracks that go from front to back or side to side? Is there a lot of phlegm on the tongue? Is there a lot of moisture on the tongue, or is it really dry? All of those things. The tongue is considered the flower of the internal organs in Chinese medicine. So if you consider your body like the soil, right? And if your flower is looking healthy, that's because it's coming from, deeper and how your body's functioning. So the tongue is very helpful. I will say during the pandemic, a great way to do this is to just take a picture in your car before you come in and
Oh yeah,
show
that's
us.
a good idea.
Mm-hmm.
That's a great idea.
Because I miss looking at the tongue. I mean, it's kind of weird and it's also kind of great, right? Because you get to stick your tongue out at somebody, but but it's
I don't
very,
mind. It doesn't weird me out. I mean, I just know I'm gonna feel better when it's over. So I just do what I'm told. I have one more question. If anybody else has questions, please feel free to put them in the chat box. How many acupuncture patients, I guess I'll say pre-pandemic, did the Milwaukee Community Acupuncture usually see, like say in a year?
Oh God. In a week, I would say that's a really hard question. So for me, and there's 6 other acupuncturists, I was working 4 shifts a week. I would probably see 80 to 90 patients a week.
Okay.
So times that by 6, by whatever. Probably, I think we were doing like 12,000 appointments a year.
Wow, that's amazing.
Yeah.
I have somebody that's raising their hand, so I'm just going to let them unmute and ask their question.
Sure.
Go ahead, Allison.
Hi. One of the things I find with cyclic vomiting is an extreme nerve sensitivity, even inside my organs. Is that something you've ever come across? And is that something you find that acupuncture can be helpful with, or is it more sensitive?
Sure. Do you feel like it's internal and it's not necessarily on the surface?
Yes, a lot of it is internal, but when I'm actively in a cyclic vomiting episode, it's also to the skin touch, where if my cat barely touches me with his paws, it's like, oh, ow.
Mm-hmm.
And I would say, Megan, that's especially during an episode, a lot of times people don't like to be touched. I remember my son being like that too. So I think that is kind of a common symptom during an episode.
That's a really good question. I would say, if you are in an active episode, maybe don't come in, or try it once and see how it goes. But that sensation is something that should lessen over time. So if you start and you're not in an episode where you're feeling like, because it's the nervous system overreacting, the nervous system is so sensitive. So that if we've been going through this traumatic experience over and over and over again, there's no down regulation. It just continues to go up and up and up because the body is trying to, preserve and make things better, but it doesn't really realize that it's just making things worse. So I would hope that after a few treatments, you would notice a reduction in that. And then when you had your episodes, it would be less and less over time. But if you are experiencing that, and you do have an acupuncture treatment, let them know and say, you know what, I'm really having a hard time today, and I just want to do really simple stuff. So instead of what we would normally, do like 15 needles, maybe we just do 4 and we let you sit, or we just do ear needles and we, anything to kind of calm that excessive response down is what acupuncture can really be good at. Just helping the body flip the switch a little bit.
Yeah, that's actually, Allison, that's a great question. I'm glad you brought that up. And it kind of reminds me a little bit of some of the stuff that our presenter in March, Dr. Leventhal, talked about with people having this sort of nervous system threshold, and makes me think, wouldn't it be great if like the Western medicine and the Chinese medicine would kind of, combine and do some of this research on how we can affect the nervous system in a profound way, right? And possibly not very invasive. So yeah, that was a great question, Allison. Yeah. Does anyone else have any other questions before we wrap things up?
Debbie, I'm sorry to interrupt. Can you hear me? It's Susan Hutchinson.
Yes, go ahead.
I don't know if it's just my computer, but mine says that the chat is disabled. So we're not able to put questions up there.
That is why. I don't know why it's disabled, but if you have a question, then please feel free to ask, Susan.
I do have a question.
All right, go ahead.
Okay. I have an unusual situation. I have a family member who has actually had a negative reaction to acupuncture, which I know is so unusual, because whenever I tell this story, people say they just don't understand it. And so I don't want to, tell people this can be a negative thing, because I think it's very, very positive. But I'm trying to understand when my family member would get acupuncture, it would actually bring on migraine headaches. So I'm trying to understand, is it their nervous system? Is there, do they have a heightened sensitivity? Are they releasing toxins? I can address that?
That's a really great question. I would say, the thing that my analogy is always, you might feel better after acupuncture and you might not. We are peeling back an onion. And have you ever had an onion that has, from the outside, it looks pretty good. And then you peel and there's a rotten layer that's like 3 deep. It's kind of, it's hard to notice from the outside, but the more that you get into it, the more complicated it can become. I have had that experience with patients of mine, where, after treatment, they will experience a migraine. The only way that I can explain that is a healing crisis. If your body has been exposed to such high levels of pain and dysfunction, anything can set it off. But I mean, my best piece of advice is that they find a different acupuncturist. And I don't mean that because that person wasn't good or that person isn't, a good acupuncturist. I mean, everybody's energy, when we're working together and I'm feeling your energy and I'm working with you and needling you, my energy and your energy are inherently linked. And maybe that person's energy is too strong for this person, and someone else, they would feel better, they would feel different. It wouldn't be so severe every time that they came in. That's why the benefit of the community is so great, because if I'm not doing something that someone's resonating with, I can recommend them to one of my coworkers, because we all have a different style. We all have a different touch. We all have a different way of looking at things. I think that's kind of the beauty of acupuncture, and also the frustration for a lot of people, because in Western medicine, it's this pill, you get this, it's very much like linear. And in Chinese medicine, it's very much artistic, right? Because there's so many different variables that we're considering that, I don't know, have you ever been to the doctor and said like, well, I have this symptom. Do you think that that's related? And they'll say, no, absolutely not. But it's all related because it's all going on inside of you. And every symptom that you're having is an expression of how your body is functioning. So I'm sorry that happened to them, but I feel like that's not that uncommon. And I would recommend that they continue to try with a different acupuncturist.
Can I just follow up with,
Sure.
we thought that might be the case. We tried 3 different acupuncturists and it happened every time.
Yeah.
So I'm just wondering, with a highly sensitive person, then do you start with fewer needles, or is there a protocol for that?
Yeah, you would start with fewer needles. You would start at the most base level that you could, and work your way up. I would be curious, about the person's lifestyle, as far as what their diet is like, what their hydration status is like, what their, those are questions that are really important. So maybe they start with a nutritionist instead of the acupuncturist, because that's even, starting at the base. Acupuncture is adjunct therapy, right? So Chinese, not even Chinese, but even kind of nutrition, as far as, acupuncturists do nutritional advice as well. But that might be too much for that person, the acupuncture needles, but a more gentle way to kind of move their chi and move their energy would be something to recommend. I would also recommend to them to start doing high dose Epsom salt baths. Epsom salts are really good. There's lots of research that magnesium is used in over 300 different enzymatic processes throughout the body. I find a lot of patients that have nervous system issues are extremely, extremely magnesium deficient. And there's a lot of research that shows that migraine patients are, like, 95% of them are extremely magnesium deficient. So when I talk to people about taking Epsom salt baths, they say, oh yeah, I put like a cup in the tub. Well, that's like saying I put like a couple drops of sugar in my coffee. That's not going to get you anywhere. There's a lot of research that says that high dose soaking in Epsom salts, your body will absorb what it needs through the skin, and it will leave what it doesn't want in the water. There's a place in Milwaukee that I really like called Float Milwaukee. And they have these, what's the word? Sensory deprivation tanks that are 1,000 pounds of Epsom salts in probably 5 inches of water. And you soak in the tub, and a lot of athletes use it for post-recovery, but I find that a lot of patients with, various autoimmune, migraine, and nervous system disorders do really, really well when they can boost up their magnesium, just to kind of give them a leg up.
That's great. That's great information, Megan. Well, now that I know that people couldn't post questions in the chat box, now I know why there weren't any. So there's a question here saying, how do they know what the right acupuncturist to treat CVS would be?
Yeah. I think that's a great question. I would say my best piece of advice is that acupuncture doesn't really look at the diagnosis. Acupuncture is more looking at the symptomology. So regardless of whether or not you have the diagnosis of CVS, the symptoms that you experience are more important to the acupuncturist than the diagnosis. So, I have treated people, and most of the conditions that people come in with, I'm familiar with. There are a few that I've never heard of, and I need to research after I see them. But when I'm seeing them, I'm asking them about how their experience is with that disease, and more so than the disease itself. Because, right, there's a whole host of different conditions that people don't present with the exact pattern of symptomology. But you could look around, ask, if you have a doctor that you trust, if they know someone that they would recommend, who's treated a lot of those patients, or if you have another, professional like a nutritionist, or, and kind of just ask around in the community, another patient, a support group. That's probably your best way to find someone.
Yeah, that's probably good. I think too, if I would assume if you ask the acupuncturist said they've treated abdominal migraines, they probably have, which are very similar to CVS. So that would be maybe another question to ask them before you see them.
Yeah.
Someone's asking if salt rooms can be effective.
No. So salt rooms are more for respiratory issues. I'm talking about the magnesium, and it's a Himalayan salt versus Epsom salts, which are totally different kinds of salts. Soaking into the skin. So you're getting the magnesium through the skin and into the muscles. I recommend to people, if you have a full bathtub, use a 4-pound bag of Epsom salts, and that's a pretty, safe dose, typical.
Wow, that's a lot.
Yeah. Yeah, but think about how much water you have in
Right,
a tub.
right. It makes sense. It's just I would never have thought like that much, but
very safe. It's very effective too. You'll feel better like after getting out of the tub. It's really fast.
Oh, that's great. That's great. I don't see any more questions. I don't think. Let me just double check. I don't think so. I want to thank you, Megan, for providing us with all this information today. It was great. And we will have the recording up. Usually we get it up in about a week or so. So if anyone wants to rewatch it and or anything like that, they're more than welcome, or share it with their doctor. But yeah, I appreciate you being with us so much today.
Thank you so much. Had a great time. Thank you.
Thanks. Bye.
Have a good day.
Thanks,
Bye-bye.
you too.